Hello and welcome to Digi8.com.
In this video, we are going to cover the topic on anger management. Now let's start with the definition of anger management. Frustration or the feeling of being obstructed from things that are important often leads to anger. Anger management is a part of psychotherapy that prevents one from getting angry and teaches people to control themselves. If worked towards appropriately, anger, according to anger management program, originates from recognizable reasons that can be examined rationally. Managing and controlling anger to prevent it from creating issues is anger management's absolute goal. Mental health counselors, psychiatrists, drug and alcohol counselors, occupational therapists, psychologists and social workers are professionals who treat people with unmanaged anger. Moving on to the potential causes of anger. First, psychological causes. Bad familial or social situations, stress, poverty, abuse and other psychological conditions can cause aggression. People may turn violent if their anger is not managed appropriately. High levels of stress, if not managed on time, can have both physical and mental consequences. Next, trauma. Aggression can increase when a person has a traumatic history. Anger is especially connected to sexual trauma and childhood trauma. This is because, in most cases, the individual is either unaware of what is happening or does not have control over it. Next, medical causes. An individual can tend to be aggressive towards other people due to medical reasons like drug addiction, mental disorders, alcohol addiction, etc. Insufficient skills to manage oneself while facing aggression results in unwanted outcomes. Next, migraines. Anger can be an issue when a person experiences recurrent migraines. It makes the person isolate themselves and entails complete rest from regular activity. Next, let's look at anger management therapy. This entails Prevention and Relationship Enhancement Program. Air Force families were used in the Prevention and Relationship Enhancement Program as subjects to study. Either conventional format of multi-couple groups or hypothetical autonomous book formats were assigned to families. These concentrated on anger management and relationship gratification. Next, personal development. Students who exhibit aggression in elementary schools are often subject to this style of treatment. The cause behind students expressing anger outbursts is very commonly pinned by researchers at the incapacity to socially adapt. In positive psychology, the mentalization program's researchers use group therapy to teach the kids. Next, cognitive behavioral theory. Cognitive behavioral therapy is very commonly used in treatments to manage anger. A patient can be mentally encouraged to make use of positive ability towards their conduct. This can be done by encouraging the patient to express their feelings and emotions openly and be motivated to finish a specified task. Next, anger journaling. Comprehending a person's own emotions can be vital to managing one's emotions. Seeing one's causes for anger would help avoid them in the future. They can at least be prepared for their sentiments in a scenario where it could not be avoided. And finally, medication. Anger being a psychological issue can be treated secondarily with medications. Beta blockers, anti-seizures, antipsychotics and antidepressants are some examples of such medications. Anger is not directly targeted by these medications, but their calming effect helps manage anger and negative sentiments better. Moving on to anger management tips. First, thoughts must be collected. Saying things spontaneously that one will regret is easy. Hence, before talking, one's thoughts must be collected. One must give others who are part of the situations a chance to collect their thoughts as well. Next, anger must be expressed after calming down. After an individual calms down, frustrations must be communicated in a non-belligerently but assertively. One's problems need to be expressed directly and clearly without offending or oppressing others. Next, engage in physical activity. Stress that is responsible for aggression can be decreased with the help of exercise. One must engage in activities that they enjoy or go on runs or walks when they start feeling aggressive. Next, take a break. One must take short breaks when things get stressful during the day. Few silent moments can help a person prepare for upcoming hurdles without becoming aggressive or irritated. Next, recognize probable solutions. The focus must be kept on solving problems that one faces instead of what made the individual angry. One must remember that anger does not fix things but ruins them even more. Next, diffuse tension with humor. Tension can be reduced if one learns to relax. Impractical expectations that a person has of the course of things and things that make the person angry can be dealt with by using humor. Next, rehearse one's ability to relax. One's ability to relax must be put to use when the person starts getting angry. Using phrases or words like take it easy that calms a person down, visualizing relaxation scenes, and rehearsing exercises involving deep breaths can help. Next, identify when to ask for help. Sometimes it can be difficult for everyone to learn to manage their anger. Since anger can hurt people around them and regret things they have done, Help must be sought if the person's anger is uncontrollable. Next, forgive. Forgiveness proves to be an almighty tool. One's feeling of injustice and bitterness can make the most of them if they let their negative sentiments and anger outweigh their positive sentiments. Next, control one's thoughts. Aggressive thoughts can increase the amount of anger a person feels. And finally, recognize triggers. Triggers for one's anger must be identified if they start losing their temper frequently. Next, let's look at the risk of suppressed anger. First, high blood pressure. Next, could lead to heart issues, headaches, skin maladies and disease. It could also lead to digestive issues. And finally of all, it could also lead to violent behavior. And finally, let's look at some examples of famous CEOs with anger issues. The first is Travis Kalanick, ex-Uber CEO who was very famous for his temper tantrums. And next in line is Steve Ballmer, ex-CEO of Microsoft. The temper of Steve Ballmer is very well known. An eminent engineer, Mark Lukoski, left Microsoft and joined Google in November 2004. His recollections about Steve Ballmer's temper tantrums are very well known. Prior to joining Google, as Mark said, he set up a meeting on November 11, 2004 with Microsoft CEO Steve Ballmer to discuss his planned departure. And at some point in the conversation, Mr. Ballmer said, "Just tell me it's not Google." And I told him it was Google. At that point, Mr. Ballmer picked up a chair and threw it across the room, hitting a table in his office. His such aggressive behavior was very well known in the circles that time. So that's it, folks. This brings an end to the topic on anger management. These are some of the sources and links referred to for the content in the video.
Thank you and see you in the next video.